Good afternoon and welcome to our weekly COVID-19 update for the town of Plymouth. I'm Steve Triffletti, your Plymouth Town Moderator. We're here each Wednesday at noon for this update. Last year in 2020, we did 79 Plymouth updates plus a regional update for a total of 80. This is number 80 as we begin our weekly updates for 2021. This is coming to you live on Wednesday, January 6th. At 12 noon. This forum is being brought to you live by PAC TV. We are on Comcast channels 15 and Verizon channel 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. For questions during today's forum, please email us at plymouthinfo@pactv.org. These forums can also be replayed at pactv.org/Plymouth. Today's participants include Kenneth Tavares, he is chair of the Plymouth Select Board, and Matthew Muratore, he is a Plymouth State Representative. And we are joined by Dr. Philip Triffletti, Dr. Barry Potvin, Carilyn Rains, Heather Cozby, Michele Pecoraro, Stephen Cole. And at this time, we're going to begin our first update for 2021 with a welcome from Kenneth Tavares, chair of the Select Board. Welcome, Ken.
Thank you, Steve. Happy New Year to everyone, and especially the panel today. We have some very strong speakers, and I'm anxious to hear their message to start off the new year. Just to inform the folks in Plymouth, the Select Board has been meeting the entire month of December with the senior staff and appointed officials. There are a number of issues that have come up on a daily basis that we're working on, and I feel the town is getting better and better prepared to do its job. When speaking of jobs, we all have one for 2021, and that is to protect one another. If you are following our daily updates from the Board of Health, you've seen a tremendous increase and the people that are testing positive. I ask you, and I beg you, to please follow the guidelines that we have been talking about for months and months. And that is, wash our hands, keep distance. We need to look out for one another. Wearing a mask is number one. It's more important today than it's ever been. So with that, Steve, I would turn this back to you. And as I said, I wish everyone a Happy New Year. And together we are going to be able to defeat that virus this year. Let's go to work.
Thank you. And that's Kenneth Tavares. He is chair of the Select Board for the town of Plymouth. We begin our updates each week with a medical component. Today, starting off with that, we have Dr. Philip Triffletti. He is an attending primary care physician at Beth Israel Deaconess. Dr. Triffletti, nice to have seen you outside of Zoom a few days ago, albeit lots of masking. What do you have for us today? A lot has happened since the last time you were with us.
Yes, well, unfortunately, it's still a mix of the good, the bad, and the ugly. And so I'm going to start off with some of the bad and the ugly first, and then we'll get over to the good part, which of course is the progress we're making with the vaccines. You may hear some data from others on the broadcast today, but if you're just in general following what's going on in Massachusetts, we're having a lot more infections per day. We're getting up around 4,000 infections per day in the state of Massachusetts compared to the peak we had in the spring, which is around 3,000. So I think that's alarming to see that those numbers are higher, and they still haven't really leveled off yet for sure. I mean, we haven't seen any downturn yet. So I think that means, we're still in the midst of this surge. And as I'm going to emphasize at the end, and like Ken was talking about at the beginning, what are the things we need to be doing besides getting the vaccine in terms of masking, et cetera. We have to be so diligent really in our practices so that we aren't contributing to this worsening surge. As I've mentioned before, and I'm sure you're all aware, as those infection numbers climb, eventually within a few weeks, you'll see hospitalizations climb, and then within several more weeks, you'll see deaths climb. So I think, we haven't seen the worst of it yet here in Massachusetts. The test positivity rate is quite high. It's at 8.5%. And the World Health Organization, actually, they recommend major lockdowns in parts of the world where it's over 5%. So, I think we're really kind of in a danger zone right now in terms of how much community spread's going on. And we have to really do everything we can to avoid that. During the summer months, our positivity rate was down below 1% at one time. So that just gives you an idea of how much more community spread's going on now compared to when in the summertime we had, pretty limited community spread. The hospitalizations now in the state of Massachusetts are up around 4,000. This peak in the springtime was around 4,000. Now, currently it's at about 2,500. And so we continue to see those hospitalization numbers climb. As I said, those numbers will follow and lag behind the infection numbers, but, we continue to see the climb. And if you look at the state website, it'll tell you, we have fairly good hospital bed capacity across all the hospitals in Massachusetts. If you look at them collectively, we still have about 15% bed capacity in all of our hospitals. We have about 25% ICU capacity when you look at all the hospitals added together. But I can tell you in our Beth Israel Lahey health system, they just sent an email this morning about they're now going to postpone all, elective surgeries for approximately 4 weeks because we're seeing climbing numbers. And at our Boston campus, for instance, we've had to create new ICU bed capacity to manage the numbers that are coming in now. So it's, we're certainly probably not as critical a situation as what you might be hearing in California, where they have, basically zero ICU bed capacity. But, I think things are getting more serious here. And again, we have to all, take on our personal responsibilities as we can to try to avoid getting infected. I think one area of interest, I'm sure, is people hearing about the variant from UK. And, I think the troubling feature about the variant is that it appears it's more contagious, maybe 50% more contagious. So that means, any person who gets the variant is going to infect more people on average than people who got the non-variant form of COVID. And as it's been reported, they've already found it in several states here that the UK variant is here in the United States. And while none have been reported yet in Massachusetts, undoubtedly, experts feel it is here. So technically speaking, the variant is not more deadly, but I think indirectly you could say it is, because if more people get infected and more people get hospitalized, then you'll have more deaths ultimately from more people getting infected. So I do think it is a serious situation to be facing a variant that's more contagious. And right now they're testing some of the vaccines in the laboratory. I think I heard a report that within a week or so, they could give us more information about how effective the vaccines appear to be against the variant. But I think so far, all the experts are fairly confident that our vaccines that we have from Moderna and Pfizer and others will continue to be effective to prevent, serious infections and hospitalizations, despite whether you're infected with the variant or not. So that's good news thus far. I get a lot of questions, of course, about, when people will be getting the vaccine. And, I continue to see a lot of progress going on with the distribution in Massachusetts. About 90% of the vaccines, I believe, that have been given now in Massachusetts have been given directly through hospitals. So as I'm sure many of you know, hospital systems got the vaccines first, and then the nursing homes and assisted living facilities are getting vaccinated by CVS and Walgreens, and I know that those vaccinations are underway. And I was very, very excited to see, I went on our mass.gov website this morning to see that as of January 11th, they're going to start to move into vaccinating it within phase 1, the category of first responders, so that you're going to see, your EMTs, firefighters, police officers all getting their vaccines starting next week. And I was very curious how this is going to be done. But in the case of their first responders, it's set up on the website, places where they can go to get the vaccine, and then they will have to present information when they go for the vaccine, just to identify themselves as a first responder. So they will be to see, people are truly in that authorized category. You'll see in the news about how well are we getting the vaccine out into people getting a shot in their arm. In Massachusetts right now, we've used up about 40% of the inventory that's currently in the state. So, obviously that's not ideal. Some states have been reported to be 20% or lower use of their inventory. Some states like South Dakota, I think, have been up around 60% of their inventory has been used. So, there are some delays in the shots getting done. And, I'm very excited to hear, what President-elect Biden's plans will be. I know he's going to put a big focus on seeing if there's ways to bolster how the vaccines are given within each individual state. But, I do see a lot of progress with the vaccines getting given. At my particular hospital system right now, we've vaccinated about 1/3 of our workers. About 73% of people who were offered the vaccine accepted it, which I think is good, but I wish it was a bit higher. I've seen reports in the news for nursing homes where the willingness to take the vaccine may be as low as 40% for some of the staff in nursing homes, although it probably can vary as high as 80%. So I think there's still a lot to be done on encouraging people to take the vaccine. I think there's hesitancy for a variety of reasons, but I certainly feel it's going to be extremely safe and extremely effective. After we get through this phase 1 of the hospital workers, long-term care workers, other congregate settings, first responders, starting in phase 2, which we hope will be sometime in February, perhaps the end of February, then you'll start to see people who are high risk by virtue of age, over 75, or people that have 2 significant medical conditions will become eligible, and then also other people who are classified as essential workers, and there's many categories for that. So that's probably still a month or 2 away to get into that phase 2. I don't think we'll get there any sooner. In terms of the supply of the vaccine, I think we're doing very well in terms of what will happen with our national inventory. The federal government has contracted with Pfizer and Moderna to have enough vaccine to immunize 200 million people in the United States, which is a good chunk of our population, almost 2/3. And that's great. And there are several other vaccine candidates that are in phase 3 trials right now, including the Johnson & Johnson vaccine, which we may know either this month or next month if that would be eligible for emergency use authorization. And then there's also a vaccine called Novavax, which is in phase 3. And there's also a GlaxoSmithKline vaccine. So there's actually 3 other vaccines in the United States that are in development that are likely to be used. It's not clear if the United States will accept the AstraZeneca vaccine that was developed in the UK. It's not as effective. There was some concerns about the research data, and so that will be delayed. And all I could find online was that they probably won't be looking at that one until at least April. But we have 2 vaccines that are approved. We have 3 more on the way. So I think we're going to have ample inventory. I actually think a bigger problem for us is not going to be the inventory. Ultimately, it's going to be people's willingness to take the vaccine. So I hope people will take it. I do want to spend just a couple minutes about, thinking about what's going wrong. Why are we in the midst of this surge? Why do the numbers keep going up? Even in Massachusetts, where I feel like culturally, our society has been, very conscientious about the universal mask wearing, for example. But I think not everybody really understands what universal masking is all about. And so I want to just talk about that a little bit. When I walk into a restaurant, and I don't sit in a restaurant and eat a meal, I get takeout food. Or when we went skiing last weekend and I went into the ski lodge, when I look around in that room, I actually I don't see it, but I imagine virus particles floating around in the air. And, we believe, of course, that this virus is airborne, and that makes it much, much more infectious. And it means that a 6-foot distance from another person isn't really enough, probably, if you have an airborne virus. So I imagine when I walk into these rooms that the people are sitting there eating, they take their masks off to eat. They might think they're at a good distance, but in fact, if this is a airborne virus, that virus is probably just floating around in the air, and you could catch it. So I think that that's where people might be letting their guard or their mask down, so to speak, is that, when you go to a restaurant and you eat in the restaurant indoors, there is virus particles probably floating around and put you at risk. And that would be the same if you're in any other indoor environment where people aren't wearing masks. So I think the big rule is you have to wear your mask all the time when you're around other people. And of course, when the holidays came and we expected, Thanksgiving and Christmas, there would be some people getting together with family members. That's the same problem. If they're not part of your household, you should really be wearing masks. Or, what I would do for holidays is I would ask my children to quarantine or do universal masking for 14 days before I would ever take my mask off in front of them. So I think that's, we know a lot of infections are happening at home from the contact tracing data. So I think that's where we're running into problems also, is that innocently people, they get together, there may only be a few people. This happened to a visiting nurse that I work with. She just got infected this past week, and, her boyfriend's daughter came over. She had a mild sore throat. She didn't think to mention it. And then, of course, she ended up getting COVID, and they were getting together. It was around near Christmas. And then, unfortunately, the visiting nurse got infected from this exposure. And it was all because it was, people who are not part of the household coming into the household to celebrate a holiday. And it wasn't many, but it was enough, to cause an infection. So yeah, I think you just cannot be careful enough. I've also discouraged patients from traveling. I had some patients that wanted to go to a bar mitzvah down in Florida. I said, don't do that. They were older patients with medical things. I said, don't travel right now. And of course, we've been discouraging that now through the holidays. The CDC has tried to restrict travel really just to essential travel. So I think if you don't need to travel right now, you really shouldn't be traveling. And just one last point I want to make about the safety and effectiveness. You may have heard in the news, probably the biggest risk we really feel with the vaccines is this issue of whether people can have serious allergic reactions. And so I think for anybody who's ever had a serious allergic reaction, what we call anaphylaxis, if they've ever required the use of epinephrine or an EpiPen, or they carry around an EpiPen for allergy, those would be the kind of people that we would still advise to get the shots, the vaccines, but that you should do it someplace where you can get prompt medical attention, like a hospital or a doctor's office, where they're prepared to treat an allergic reaction if you get a serious one. So, and then the only other category, there is a rare neurological condition called Guillain-Barré syndrome. And I know that Dr. Fauci has recommended that those patients not receive the vaccine. But other than that, everybody else is eligible. So I think when your number comes up, you should definitely take advantage of it. My number came up for tomorrow morning at 8 a.m. And so I am thrilled to go get in line and get my vaccine. And I hope all of you will have an opportunity very soon also to get your vaccines. So thank you, Steve, for having me today. I am prepared to take questions later during the broadcast. And Happy New Year to everyone.
Thank you, Dr. Philip Triffletti. He is an attending primary care physician at Beth Israel Deaconess. And Dr. Phil, I too was in that ski lodge, and I didn't see any particles, as you didn't. But I appreciate your imagination and that illustration that we should keep in mind. With respect to the elective surgeries that you mentioned, I want to tell our viewers that next week we'll be joined by Dr. Craig Gillard. He is a local urologist and also surgeon. And when I spoke with him yesterday, he's had to postpone many of his planned surgeries because of these new protocols that have been implemented at the Plymouth campus in Beth Israel. You'll hear more about that next week. And now we're going to continue our medical segment with Dr. Barry Potvin, and he is chair of the Plymouth Board of Health. Good afternoon, Barry.
Steve, before Barry
Okay, go ahead, Ken.
talks, I'd like to acknowledge that I think that Matt Muratore just took his oath while his Dr. Triffletti was talking. And I think we ought to give him applause because that was most unusual, I think, than any other time that he's taken his oath. He's done it in his home without a tie on. Good for you. And let's give him a round of applause. I'm sorry to interrupt, but I think it's that important to do it. Thank you. I apologize.
Thank you very much. Appreciate that.
Thank you.
Yeah,
Congratulations.
it is a little unusual. I'm so sorry. I'm standing up and waving my hand. But when the governor starts all this, we have to pay attention. So we all have a boss.
Thank you. Plymouth State Representative Matthew Muratore, congratulations on your reelection. And at this time, we're going to go to Dr. Barry Potvin. He is Professor Emeritus at Yeshiva University in the Department of Biology. Welcome, Dr. Potvin.
Yes, hi Steve. Happy New Year, everyone, and congratulations again to Matt. Before we get going into some information about the vaccines, I'd like to point out that for those of you who aren't able to see it or hear it, at 9:00 p.m. on New Year's Eve, Bill Cohen managed to be able to ring the town bell one time for each of the 106 people who have perished from COVID in Plymouth. I was there with my wife, listened to the whole thing. It was very difficult to not get cheered up with that. It was an extremely emotional experience. It will be rung again the last Sunday of every month, I believe, at 4 p.m. And I certainly hope the number of bell ringings doesn't have to go up too quickly, but it certainly will be adjusted. And so thanks again to Bill Cohen for doing that for us. With respect to the British variant, I just want to give you some assurance that because of what happens when you get the vaccine, you produce something that's actually multiple antibodies against the virus. And it's highly unlikely that any one virus would be able to escape all the different antibodies against all the different structures. And so it's probably easily possible that all of our vaccines will still work against the new variant. I've tried to organize this today so that you could see things, and I'm going to use some screen sharing with it. So if you look at this chart, and there'll be another one that'll be coming out with data tomorrow evening after 5 p.m., you can see that the average daily cases per 100,000 in Massachusetts has been going up, and it's been going up rather steadily. It's also the case here in Plymouth, and this chart really is for the town of Plymouth. You can see that there was a sudden sort of very steep increase shortly after Thanksgiving. We're unfortunately expecting the same thing that's likely to happen in another week or so after the Christmas and the New Year's holidays are over. Fortunately, at least for a while, the Massachusetts red communities, which are high-risk communities, have seemed to have leveled off for a little while. And so there's news here. There'll be more news about it. And I would then like to go to this. You can probably tell that I've been doing class lectures for quite a long time in my life. And so here is some really valuable information for you. The COVID-19 Interactive Data Dashboard just came online. The link for that is illustrated here. And if you were to look at this, you would find this. Oops, I gotta stop the share and go back to this. It's this one. So this is the new interactive data dashboard that the state has put out. And I can't probably do it very easily. Whoops, I'm getting an unexpected error. So I guess you saw it just briefly. There it is again. You can click on any of the things on the left-hand column and you'll get more data. They're actually updating this on a daily basis. So as Dr. Triffletti said, yesterday there were 4,178 new cases, bringing the total in Massachusetts to 379,633. You can look at deaths and you see that there were 63 new deaths yesterday in the state. There's now 12,464 confirmed deaths. And these numbers are being updated every day. And so you can look at it if you use that link, and you notice there's even things over here about city and town. So you can actually get some information just by clicking on Plymouth, on a map of Plymouth, and you can see some of the information there. There's also information about hospitalizations and how many empty beds still remain, both for general use and also in ICUs. So it's an extremely valuable interactive site, and I think everybody will find it very useful. And going back again to this, there's some things to point out to you here. This came out recently. The average age for those who are actually being hospitalized actually was before Thanksgiving averaging 60 to 61 years of age, but since Thanksgiving, that's gone up to 73. That's concerning because the older people get who are hospitalized, probably the more deaths you're going to see. This is a summary that I made, and I'll be doing this again at the Board of Health meeting a week from Wednesday. You'll notice here the kinds of vaccines that have existed over the years. And if you look through this, and I'll explain why this is important in a minute, there were these live attenuated or weakened virus vaccines, include for those of us who remember the Sabin polio vaccine, measles, mumps, rubella, chickenpox, and one of the early shingles vaccines. Then they had these inactivated or killed vaccines where the viruses were grown, but they're actually killed with a chemical process. This required the growth of viruses and then the inactivation. Examples of that are the Salk vaccine, hepatitis A, pertussis, rabies, and influenza that we're all familiar with. Both of these require the growth of viruses in huge numbers in the laboratory, and that's one of the reasons why it took so long to get these particular vaccines ready. It took years and years to do this. Then there are some other ones that use new technology called recombinant subunit or conjugate vaccines. In this case, they grow a harmless virus called the adenovirus that actually was isolated and infects other animals. But they inserted genetic material or purified proteins from the targeted disease-causing virus into that, and then they inject this into patients. They use this for hepatitis B, for the newer shingles vaccine, for HPV, for some of the pneumonia vaccines, and notice it's also the kind of vaccine that is covered by Johnson & Johnson that hasn't yet been approved, and also the one in the Soviet Union and Russia called Sputnik 5. That all belongs to those. So they're not using live viruses that cause the disease here. They're just using a carrier, a safe virus, to transport the genetic information into the cells. The ones we're dealing with now are messenger RNA viruses, vaccines. And you notice that they've, courtesy of the Chinese scientists, pulled out the genetic sequence for the little spike protein that's on the surface of the viruses. They've got the messenger RNA for it. They mass produce that. They enclose the messenger RNA in a little tiny droplet of liquid. And those are the Pfizer and the Moderna vaccines. So in terms of safety, these bottom two are probably the safest vaccines. There's no viruses that cause those diseases included in these vaccines. Up on the top two, they use weakened vaccines, weakened viruses for the vaccines and the killed vaccines. And there has been rare instances where these viruses that are weakened have mutated back and caused the disease. And there were rare instances also where the inactivated polio Salk vaccine actually wasn't totally killed back in the 1950s and did cause some cases of polio. So it's important you realize that these two vaccines should be extremely safe. We're talking before, and I'm not going to go through this in detail, about when can I get the vaccine. And Dr. Phil started this. Phase 1 is already in progress. Just look at the bolded terms here. It's the clinical and non-clinical healthcare workers doing direct COVID-facing care, long-term facilities, rest homes, assisted living facilities, and then emergency medical services workers. That's our police and our fire departments, also med flight staff, some police at college campuses. That's in progress starting this coming week. And here in Plymouth, they're going to be using a couple of the fire stations and the police station to distribute the vaccine to those groups. The congregate care settings was being done mostly by CVS and by Walgreens pharmacists, and those are also in progress. As you go down through the list, notice that these people were getting the vaccine at their place of employment. They were also being done by this Federal Pharmacy Partnership Program, which is CVS and Walgreens and long-term care facilities. And a lot of this was being done in congregate care settings. Then we go to phase 2, and they listed that as being February to March of this year. It's likely to be later in February. This is for individuals with 2 or more comorbid conditions and people who are age 75 and above. And then they get into much larger groups of people that are categorized as essential workers. And then they get to people who are 65 to 74, and then to individuals that have 1 comorbid condition. People have asked a lot of questions about what does that mean? Well, these are the comorbid conditions. I don't have time to go through all of them with you, but these are the kinds of things that put you at increased risk for serious illness. And if you have these and 2 of these, and there's another list further down, you would be moved up in the priority list because it puts you at increased risk. So that's what's going on with those. These charts will be posted on the town website, on the Department of Public Health website, and you can see them again at the Board of Health meeting this coming Wednesday. Then you go to phase 3. They figure it might start in April. This is when the general public can get the vaccines. And once this is available, everyone would be notified, and there would be this little website called vaccinefinder.org where you could find out where you could receive the vaccines. They are setting up some mass vaccination sites in 4 locations across the state. So far, there hasn't been anything close to us. The closest one would be at Gillette Stadium, but we'll be talking more about that also. And finally, I wanted to make sure that everybody knows that safety after vaccination. So I've gotten my vaccine. Dr. Phil, you're going to go in and get a shot in the arm tomorrow. What does that mean for me? Am I safe now? Can I do anything I want now? Well, no, you can't. And the reason is it'll take a couple of weeks after you get the vaccination in order for your body to make the antibodies that will at least partially protect you from being infected. The first dose, if there's 2 doses, also only gives you partial immunity. It's not until you get the second dose 3 to 4 weeks later that your immunity goes up to about 95%. But notice it's not 100%. And so that means there's still a 5% chance that I could still get the infection even after I've had 2 doses of the vaccine. Immunity means you don't get symptoms of the disease, but you still could produce viruses and you still could infect others. That's not known for sure yet. They're investigating that at the moment. But that's why even after you get the vaccine and after you get both doses of the vaccine, you still must wear face coverings and you still must observe physical distancing when you're near others until we achieve what is commonly known as herd immunity. And quite frankly, 30 to 40% of people getting the vaccine is not going to be enough. We have to get this up to around 70% minimum of the total population for this to be achieved. Only then can we go back to some degree of normality. So I hope that helps. I gave you a lot of information as quickly as I possibly could. Please know, however, that we will be going through this for a full hour and a half to 2 hours on Wednesday night. We can give you a lot more information then if you would like to actually watch the Board of Health meeting this on Wednesday night, which will be the 13th of January. That's the best I could do as quickly as I could. Thank you, Steve.
Thank you, Dr. Barry Potvin. He is Professor Emeritus, Department of Biology, Yeshiva University, and our chair of the Plymouth Board of Health. And at this time, we're going to continue with our education segment. And from the Plymouth Public Schools, we welcome back once again Carilyn Rain. She is Director of Health Services. Welcome, Carilyn.
Hi, thank you, everybody. We really appreciate the opportunity to be part of your program again today. And I do want to start off also too by congratulating Matt. I don't know if anybody knows this, but Matt has been a great advocate for school health service programs and school nurses over my time that I've been in Plymouth. He's been great supporting legislation that advocates for school nurse practice. So just wanted to congratulate him. And also to thank Dr. Potvin for all of his high level of engagement and support and collaboration that he's had with us in the schools during these times. He's been amazing, as has Karen Keene, our Director of Public Health. And so just to talk a little bit about what's been going on in our schools, we just returned on Monday from our Christmas break. Fortunately, through some really good communication, transparency from our families, as well as working closely with Karen Keene through Maven, we were able to update our dashboard over the number of positive cases for us students and staff that occurred over the break. And we published those numbers already on Monday. And also now in the continuing to work, my nurses have been working really pretty diligently, doing contact tracings, working with families, educating them, just in terms of so many questions that people have. A lot of our families are coming back from having traveled. Kids are in quarantine. We're also staying in close contact with all of those families as well. Doing a lot of education and support with teaching staff, which I think is really important. I'm not really sure teachers are struggling. I know with, doing, educating children, which is what our whole sole purpose is in schools. And it's difficult having kids in front, face to face, and then having another cohort for the other 2 days, and also doing remote learning with the kids. I actually have had the opportunity today to be covering in a school today and yesterday in one of our elementary schools, and have really been able to see, so much of them, what is going on and how proactive everybody is in the buildings in terms of utilizing the mitigation strategies that we've put in place. Kids are washing their hands, they're wearing their masks. And I really have to applaud them. They're such little kids, and they're doing such a great job in terms of the teachers maintaining the distancing, making sure that both for our families and our teachers, that people are symptom monitoring every day, not coming into work sick. It was almost this time last year that we saw an exorbitant number of confirmed flu cases in our schools with students and staff. So I think, just even using these prevention strategies, I think we're seeing people are staying healthier on many levels. I think it certainly, speaks to how diligent everybody has been trying to be. Now, I think in every case, we can't control what goes on outside school. Families have, lives over the holidays. They've had gatherings, kids participate in sports. They have social events. And so as much as we can do, we have been attempting to educate our entire school community on, just some safety strategies that they can put into place. Dr. Campbell has been great in communicating out to the entire school community, staff, families, students, in the community at large, just in general around some of the new updates. And I think people have to remember too, and I think we talk a lot about this with some of the community physician practices, that because we're in the educational setting, we have to abide by Department of Education guidelines as well. So it's been great that since the Department of Public Health and DESE have putting together some joint guidance for us. We were a little behind in terms of updating our quarantine guidelines to reflect the possibility of people being able to test on day 5 and return on day 8 if they're a close contact and have remained asymptomatic. But that has worked out well. We have put out a brand new infographic that talks about like what really a close contact is, if someone in your house is sick versus if someone's a close contact. We're really fortunate that we have a direct line right to the state epidemiologists who have been really great in providing us guidance. And we always seem to have new scenarios every day that we have questions for them on. There are some families that experienced COVID back in September that are experiencing it again, and how do we manage those cases? But I have to say that our families have been super transparent and communicative. Yesterday, I had some great conversations with some parents here at the school who really applauded the district in terms of, what their perception was and how safe they felt having their child be in school here in Plymouth. And I think that really speaks to all of the hard work that everybody is doing, in terms of doing our best to keep the entire school community healthy and safe, while trying to optimize learning for the kids. And, I know the kids have talked about the remote learning. It's not optimal for all of them. It's, I'm sure, very stressful. We know that the social emotional health implications are great for kids. The feelings of isolation they've had, mental health issues. So trying to step up and also address those concerns has been, paramount for us as well in the district. I think that one of the bigger pieces too to mention is that school nurses were recently included by the state in the first responder group. So my school nurses will be able to receive the vaccine next week. And again, this speaks again to the great community collaboration that's gone on in Plymouth with Mike Bateri, with the fire chief, Karen Keene, and just, and Barry Potvin, and being able to everybody to work together to assure health and safety for all of our residents. Can't really think of too much else. I'm certainly, happy to answer any questions anybody has for us. And I do just want to say how grateful I am to be able to work with Dr. Campbell. He is morning, noon, and night, being very diligent in all his work and all the support he's giving his staff around administrative staff and teaching staff around, trying to stay proactive and be available and listen to people's concerns, because people will have concerns throughout all of this as we move forward. It is disheartening to see the numbers continuing to go up across the town. That certainly obviously impacts the school-age child. Our cases have significantly come from household contacts. We are not aware, following state guidelines on what a close contact is, have seen any transmissions in the school. So we're continuing to monitor that, looking at, what kids are doing if they're on the bus, what classes they're in, do they play a sport? So there's so many factors that we take into account when we're looking at our numbers, and try to, make sure that we're contacting families and schools if we have any concerns about an in-contact school contact that could be potentially a problem. So once again, thank you for having me today, and look forward to any questions anybody would have.
Thank you, Carilyn Rain. She is Director of Health Services, Plymouth Public Schools. And we're now going to move and welcome back Michele Pecoraro. She is the Executive Director of Plymouth 400. Welcome, Michele.
Hello, and thank you, Steve, and thank you to everybody who's on today and who's in the audience. And Happy New Year. It has definitely been an eventful 2020, not in the way that we had thought, but certainly eventful. However, what I'd like to do today is just give you an update on what programming and things that Plymouth 400 has been doing and has planned for the winter, and then what live events look like in the future. So without further ado, I will say that this fall was extremely good for media in terms of Plymouth, with many places like Plymouth Plantation, See Plymouth, the Chamber, and Plymouth 400 constantly pumping out information and press releases and doing interviews. We had quite a lot of interest, especially this year, in Thanksgiving and the Thanksgiving story and what's going on during COVID over Thanksgiving. So we did well in the press. CBS this weekend did a great piece on us. USA, when I say us, it's all of Plymouth, not just Plymouth 400. USA Today, Boston Globe, Fox News, Christian Science Monitor, Cape Cod Times, all of them, and then more smaller papers around the country. We also, Lee Filson and I know you'll be talking with Lee tomorrow. We did a radio tour on the Monday before Thanksgiving, meaning we sat at our desks and called into radio stations all over the country. We did about 23 interviews on that day between the two of us. And so, again, getting the word out that when things are ready, when people are ready to be able to travel and be able to move around, that we're, Plymouth is a safe place to be during that, once that happens. We, Plymouth 400, have done several, a lot of work was done over the last 8 to 10 years. People wrote books in preparation for the 400th. People wrote plays. They had programs put together specifically for the 400th anniversary. And so Well, first I'd like to say kudos to Plymouth's nonprofits. I know we don't talk about them a lot, but they're usually a group who are slow to adopt changes. And I have to say that I'm so impressed with the organizations in this town that have risen to the occasion and have produced some incredibly informative programming online. And so if you haven't caught any of that, check out your favorite nonprofit and see what's happening. I know the Phil just did a wonderful concert, and Pilgrim Hall Museum has been doing tours of Burial Hill. We've done several things which I'll tell you about in Plymouth Plantation, of course, and I'm sure I'm missing some, but kudos to all of them. I just want to say that. And Plymouth has gotten well wishes from all over the world because of 2020 being, kind of quelched. We have gotten a lot of people who we don't even know just saying, we're so sorry and we hope that you're able to go forward. So those are all great things. We were able to take a conference, the BSU Indigenous History Conference, Bridgewater State University, our Wampanoag Advisory Committee, and Plymouth 400 partnered. And in October and November, we took a live event and made it a virtual event and did 9 sessions of the Indigenous History Conference with Bridgewater State University. Highly successful. Over 1,500 people actually were able to be at the conference, which if we had done it live, about 400 people would have been able to access it. So that was great. We revealed the final chapter of a long time exhibit, Our Story, that we are working on. We did that virtually as well. And we also did launch the Mass Chronicles book. We should all be proud of this. A lot of organizations in this town were involved in this, and in the state of Massachusetts, not just in this town. So this book went to every public school in Massachusetts. That's about 1,000, that's about 1,800 plus schools. And then we also sent them an educator's guide. So, not just the story of Plymouth, but the story of Massachusetts, which was spearheaded by us and Bridgewater, and Plymouth Public Schools was a huge contributor to that. In fact, they were responsible for the educator's guide, and Bridgewater was responsible for doing credit hours for teachers. And so it's a full package, and we're very proud of that. And thank you to everybody who was involved in that. And then we also did have 2 One Small Candle Award recipients, even though we were unable to do our Illuminate Thanksgiving again this year. We did have 2 recipients, and we will be, you might have seen them on NBC. They were revealed on NBC. We will be having a virtual event with all of the former One Small Candle Award winners and the new ones sometime in February. And we're also working on with the Registry of Deeds, a colonial documents virtual exhibit, which many people that you will recognize are part of. So we will have more information on that as to when that gets launched in the near future. So events. Well, we went from our plan A, which was, 2020, to a plan B, which included us doing 3 events in April, May, and June. We are now pausing the June event. April and May, we may end up being a virtual events as well, or hybrid events. But we want to have this Maritime Festival to celebrate the fact that our harbor is dredged, and we can welcome visiting ships to highlight the Mayflower being in the harbor. And so we're on a holding pattern for that right now. we're going to wait until we see what happens. And after hearing both doctors speak, it becomes more clear that sliding it from June to perhaps August or September is something that we may have to consider doing. So we can't really make that decision until we know more. However, that's where we stand right now, and we will keep you updated on our website. It's plymouth400inc.org. We still are very much working with our partners at the Chamber, at C Plymouth, to make sure that when the time is right, we can really bring back not just tourism, but our local communities back to Plymouth and really help the businesses here, because we talk a lot about safety, and that's highly the first number one important thing. The second important thing, I think, is to make sure that our businesses are intact. And I know that's a hard thing to do, but we are all hoping that the Maritime Festival can maybe be the big thing that kicks off all of the other events that will happen later in 2021. So that's all I have. I look forward to any questions, and thank you for the time to be able to give you an update.
Thank you, Michele Pecoraro. She's the Executive Director, Plymouth 400. We're now going to go to our Plymouth CPA, Heather Cozby. Welcome back, Heather.
Hi, Steve. Hi, everybody. It's good to see everyone. So a couple weeks ago I was on, and they had just passed the law that hadn't been signed. Everybody knows it did finally get signed, December 27th. I'm going to go into the federal law second. I wanted to actually start this conversation with the Massachusetts grant that came out. It was opened up January 1st, and it's accepting applications through January 15th. This is a grant they're calling Sector-Specific Relief Grant. It's $668 million that is for the businesses that are hurt the worst. And so I want to make sure all our businesses in Plymouth understand this information and can go and apply for it before the grant application closes on January 15th. It's being administered by the Massachusetts Growth Capital Corporation. And I do have a link, which I'll ask to have put up just so you can see it in a minute. But the most important thing is that it's a businesses that have to have losses for 2020. Those would be restaurants, bars, food trucks, indoor recreation like sports arenas, movie theaters. Think of all the places that still aren't open. If you're one of those organizations that are extremely limited, you will probably qualify for this grant. You've got your gyms, your fitness facilities, personal services, hairdressers, people that have really experienced huge reduction in their income last year, as well as some independent retailers. So the loan, or the grant that you can get, not a loan, it's a grant, it's up to $75,000, and it's capped at 3 months of your operating expenses for 2019. So this is, again, a huge item that I don't see publicized that much. I wanted to really spend some time to make sure people understood it existed. The money has to be used for payroll and benefits for your employees, mortgage interest or interest on other debt, rent, and utilities. So it's similar to the PPP loan. It's obviously you can't double dip on the same expenses, but you got a whole year of expenses. And if PPP gave you 2.5 months of expenses, this grant can give you another 3 months of expenses. So there is a link. I don't know if they're going to show that link right now. Maybe not. So if not, you can write into the show. I can get you the information on that. So that's the Massachusetts sector-specific grant. The second piece that I wanted to talk about for the businesses is that I've always asked you to go get your information from SBA.gov. Go look at the U.S. Treasury website about all these new laws or the PPP loans. As of this morning at 10:30, none of that information has been updated for the new law. So if you're going and trying to find information, I wanted to make it very clear that it has not been provided and there's been nothing written on SBA.gov. So as you're looking for this new information, make sure you're looking at items that are written after December 27th. Literally everything on the PPP loan page for SBA is old and inaccurate according to the new law that was just passed. So don't get yourself frustrated or confused. Just keep looking for those dates to be updated. I heard one organization talk that the SBA might have updated information by January 11th. So everybody's excited to figure out how can we get another round of PPP funding? How can we take advantage of this new easy debt forgiveness if your loan's under $150,000? Just sit tight a little bit longer. It takes time for the SBA to come up with the new regulations that need to be to explain all of this, new frequently asked questions, new forms, and give yourself about another 2 weeks before you start to go look for the info because it's just not available. So the other thing I wanted to, this law that was signed, I went into it briefly. People, individuals who are getting payments, the earliest I've heard somebody see it hit their bank account was on January 1st. So this is the $600 per person payment. You may have already received it and not known it. You're not going to get a letter ahead. It's just going to show up if you got money before. Again, there's nothing being issued from agencies describing what's happening. They're just trying to get the money out. So check your bank account. If you see something that says U.S. Treasury and it's 600 or somewhere between 600 and 1,200 if you're married, but you might have phased out in your income, that's what it is. And hopefully you'll get some follow-up letter explaining what your amount was. But the law itself, so the law is 5,000 pages. And I have an executive summary from the American Institute of CPAs that is written very small and very single line item that is 4 pages long. There is a lot of information. I have provided this summary to our town moderator, Steve Triffletti. Again, if somebody wanted to have that information, we could email it out to you if you contact the show. I'm not going to go into the detail because it's extensive, but a lot of tax benefits that were expiring. So we'll have things where you can do credits on for energy efficient items, things like that. They were expired. There's a lot of tax extenders in this law, and it's for businesses, for individuals. There's just a lot of things that might have been sunsetting that have been now, they're extended for 1 year, they're extended for 2 years. Some of them are extended for 5 years. So there's just a lot of information, and I recommend that you search for a summary. I provided a summary to the show so that you can go through that. And again, there's been no regulations issued by the IRS interpreting this law yet. So we're all sitting back waiting for that. And then one other thing that I wanted to go over that I'm getting a lot of questions about, and I'm realizing that it is a big issue that's going to affect certain taxpayers. If you were a person that worked in an office and then began working at home remotely, if you happen to work in a different state, say Rhode Island, New Hampshire, or if you worked in Massachusetts and live in Rhode Island, New Hampshire, if when you started to work remotely, you changed state, you are going to have tax issues. And what that means is that when you go and you go over to Rhode Island and you work there, they were doing with Rhode Island withholdings, but you're a Mass resident. If you then started being a Mass resident working from home, that becomes Massachusetts sourced income. And a lot of withholdings weren't changed. They're just not done correctly. So this is an issue, again, if you change state by the process of having to work remotely, I highly recommend you start now to talk to your accountant, or if you normally do your taxes because they're simple, you may need an accountant. So that is a big issue that's coming up a lot, and there's going to be a lot of compliance problems. And people are going to owe to one state and have to wait for a refund from another state. So that is that's just a headache that's coming that I know it's coming. So and then the last thing, because there's just so much information, I could probably do an hour show, but they won't give me that. That's fine. But the last thing is that I'm concerned about, which the IRS has been pretty silent on. This law changed the forms for 2020. So the IRS has to redo forms and instructions for the 2020 tax returns. Then tax software companies have to reprogram the tax software that practitioners use. Then that has to be approved by the IRS, by each software company, and then we can start filing tax returns. So the IRS, I think, has a position that e-filing will be open around the 23rd of January. I'm not too sure that's happening, so I just want to remind everybody to be really patient. We know as practitioners that you need your money, you need your refund, but if we literally cannot be processing tax returns, I wanted you to know why. So just continue. This season is, require a lot of patience. A lot of offices aren't allowing any clients in. I'm allowing clients in on a very limited basis. So, just know that everybody's doing their best. We're all worried for everybody. We want to keep everybody safe, our staff, ourselves included. And, just continue to have patience this season. Everybody wants their money. And, everybody in town, all the practitioners in town, I know are doing the best they can. But I wanted to at least explain why the delay happened, and it's entirely out of our control. So that's the update for now. I'm sure there'll be some more information in a few weeks from SBA and the U.S. Treasury. Thank you.
Thank you, Heather Cozby. She's a CPA in the town of Plymouth. We're going to go directly to Stephen Cole, Executive Director, Plymouth Regional Economic Development Foundation. Welcome, Steve.
Thanks, Steve. Happy New Year, folks. I too would congratulate our intrepid state rep, but I think if he gets one more proper compliment, he becomes Pope by acclamation. So I will withhold that so we can keep him here in Plymouth. I'm going to jump right into the hard numbers here. The last time I was here was actually a few weeks ago, but at that time we were talking about an unemployment rate here in the town of Plymouth, not the county or the state, but the town of Plymouth at 6.2%. That number was as of 11/14. As of 12/26, we have crept up a little bit. It's 6.6 as of the latest reporting. What that means is that, and it hasn't been that number since, by the way, Halloween. 10/31 was the last time I was here, and I reported that 6.6 was our unemployment. So we had been positive trends, and now we've crept back up. This was, though, expected, especially as we were seeing the expiration of unemployment benefits for some folks. But I just want to put a hard number on this. There are 2,209 people in our community who are looking for a job and do not have one. So I'll put that in the back. Put that in the back of your minds, because when we circle back, I'm going to tell you what to do about that. Okay. In the meantime, I have some positive news though, and I want to share with you that GM is now reporting that auto sales are back into pre-pandemic sales, and why that's important. If you're not buying a new car, you're not creating a used car in the marketplace. Used cars are very important for folks in our area. We are a blue collar community. We rely on used transportation and sometimes secondhand things. So when the used market is tied up, it's partly because the used market, the new market is tied up. So I'm glad to report that GM is reporting that sales for vehicles are back to pre-pandemic levels. We're also seeing some things coming from the World Bank that I want to share. If trends continue, and as optimistically as we are, and with everything that Dr. Barry and Dr. Phil have told us, precipitates with the vaccine, World Bank is forecasting that we will see a world growth in the world economy by about 4% in 21. If, however, we are not good about wearing our masks and we do not follow the protocols and the procedures, frankly, it's a much more dire prediction. And the best case for that is at 1.6% growth for the entire world. And I want to clarify, too, that this is not a proportionate growth across all borders and boundaries. China can perform very well, but if the United States does not, we do not see the world growth that we're expecting. The United States is a very big part of this, even though we're third largest by landmass and population. There are many, many factors that we influence in the world, and we are responsible for, on average, about 25% of some of the predictions and forecasts. So when I say the world is genuinely looking toward us to do the right thing, they really are. I mean that this time. That said, I also want to say that I won't go into great detail, because I know the rep wants to talk some about what they were able to accomplish in the early morning hours today. But I am so very proud of our legislature. We have a $627 million economic stimulus bill, as well as some transportation that we can look forward to. I will pause here in the shadow of some good news, and look forward to answering any questions, comments, or concerns as we circle back. Thanks, Steve.
Thanks, Stephen Cole. He's Executive Director of Plymouth Regional Economic Development Foundation. And we're now going to round out our panel with Plymouth State Representative Matthew Muratore. Again, congratulations, Matt.
Thanks, Steve. Appreciate that. And yes, as Steve Cole said, we were working till 4:30 this morning, so I'm a little exhausted. And we were back at it at 10 o'clock this morning. We're in the process of voting for a new speaker now, which will be Ron Mariano again for the second time this week, because we are now in the 192nd session of the General Court of Massachusetts. So we're off and running again. So it's good to be back and good to be working with all of you. I do want to just compliment Michele for her background. That's great marketing there, to see all those items in the background there. that people can purchase. They're going to be really some wonderful, they're going to be in demand soon. So now's the time to start getting them. So good marketing tool there. I also want to just thank Dr. Potvin and Chairman Tavares for, we don't realize how lucky we are in this community to have such competent boards that work together. And they're working together well. They're being proactive. They're getting the information out on a timely basis. And if they can't figure it out, they reach out and they work together to do it. So we thank them as well. And I do want to just touch upon what Carilyn said about the school nurses. There's a lot of heroes during this whole pandemic. And, we always hear about, healthcare workers and teachers and grocery store workers. But, the school nurses are really the unsung heroes. And I'm proud to be part of the Plymouth Sunrise Rotary Club. And we decided a couple months ago to do a monthly gift basket worth $500 that we're raffling off online every month, with the proceeds going to the school nurses in the Plymouth school systems. Because there's such need for supplies and other items that they need, we wanted to recognize them for the work they do. So, Carilyn, please extend our thanks and congratulations to the school nurses for everything that they're doing. We appreciate that. With that said, I don't have a lot to say because everyone took all my information today. But I will give you a little bit of an overview of the state numbers. The active cases are approaching 80,000 at this point, with the total cases since March of 352,500. We've had 261,600 folks who've been released from isolation. We've had 12,400 deaths since this all began. The hospitals, we're still creeping up in the hospitalizations. We're at 2,428. And again, I just keep reminding people at the height of this back in the spring, we had people hospitalized with COVID-19 close to 4,000. We also have the 7-day average in the Commonwealth is now 8.51%. The last 2 weeks, I know Dr. Potvin showed these numbers, but interesting when you break them down, you look at the 0 to 29-year-old folks over the last couple of weeks that were infected. It's almost 20,000 folks in that category. The folks between the ages of 30 and 49, it's almost 17,000 folks. The ages between 50 and 69, close to 15,000 folks have been infected, and over 70 is 5,500. So you can see the big discrepancy, which again is different than what it was back in the spring. We were seeing the numbers just the opposite. There were many more over the age of 60 and 70, 80 years old that were getting this disease. In Plymouth County, the total that have been tested to date have been over 528,000, with 23,800 that have been confirmed with the coronavirus, and we're running at an 8.2% rate here in Plymouth County. And in Plymouth, there's been over 2,000 cases so far, with 57,800 tests performed. And we're running in Plymouth a little bit better than the state average. We're at 6.2%. But again, the threshold it should be under 4%. So, which is why we are one of the reasons why we're still in the red category. And I know Dr. Triffletti brought up about the vaccines, and there has been a slow start to these vaccines, but more plans are being made on processes and how they're going to be given out to the different segments. Dr. Potvin did a great job of breaking down the phases and how this is going to work. So far, the state has over 300,000 vaccines that's received. Over 80,000 have been given out so far. And out of that number, we've had 11,000 in Plymouth County that have been given out. And again, mostly all this is to long-term care facilities and healthcare workers as well. The only other thing that I do want to talk about, give a little bit more detail than what Heather gave with regard to the state grant money. I just want to give just a little bit of some more businesses that people may not realize that could be part of this. It's obviously restaurants, bars, caterers, food trucks, indoor recreations, like movie theaters, performing arts centers, arcades, bowling alleys, gyms, fitness centers, yoga studios, aerobic studios, nail salons, barber shops, florist shops, limos, event planning, photography, videography, anything around event planning. These people are in this phase for these grants, and they may not think that. That's why I wanted to kind of mention those today. And of course, other retailers as well. And as Heather said, the application, you want to get the applications in now because there's going to be thousands and thousands that are going to be submitted. And they're going to do the best they can to get out as much as they can, as quickly as they can to the businesses that are in need. And the other comment I want to make that Heather talked about was the PPP money that's going to be coming out. I would encourage people to get a hold of your banks now, just to let them know to be prepared that you are going to be applying for this. Banks are reaching out to folks now, wanting to get at least businesses lined up. So it would be good to do that. And the last thing is just to confirm cases for the month of December. When you look at how the spread is going, household spread is by far still the greatest concern that we have. In the month of December, there were 51,000 cases of COVID-19 that came from households. And the second one was through long-term care, which was just over 1,100. So you can see the big disparity of what we're seeing. And again, the vaccine can't come fast enough, but the mask's still going to have to be worn for several more months until we can get up to that 70, 80% of folks that are vaccinated. And that's my update for today, Steve.
Thank you. And that's Plymouth State Representative Matthew Muratore. Last week, we did not have an update, and it's clear today we had lots of information from all of our panelists. We're going to go through quickly for a quick takeaway from our remaining panelists, but we're also going to begin with a question to Dr. Barry Potvin. Dr. Potvin, does the town plan to set up public clinics, including one at the senior center? This is a question from viewer Judy. Dr. Potvin.
Thanks, Steve. Certainly, we're hoping to be able to do that. There's a lot of conversations going on among town officials at the moment as to exactly how we can do it, where it would be located, when it would happen. There's a lot of details that have to be planned for that, but it's an ongoing topic of discussion among an awful lot of people and department heads here in Plymouth. Best thing I could say is we're working on it. We're hopeful we can do it.
Thank you. And Dr. Potvin, what is your takeaway today?
Basically, I guess the best thing to say is that we're hoping for the vaccine. Well, the vaccine is here, not a huge amount of it, but there's more coming. But just remember that it's not really very useful until we actually get it into people. And so we really, really are going to have to do an awful lot of community outreach and education to convince as many people as we possibly can that it's vital that they take this vaccine as soon as they're eligible to take it.
Thank you. Dr. Barry Potvin, he is chair of the Plymouth Board of Health. Carilyn Rains, you've had an opportunity to hear the other panelists. Anything else you'd like to add today?
I think no, other than the fact that I really believe that schools are a very safe environment for our students and staff to be in, and that we're just continuing to work hard so that we can stay open and educate our kids.
Carilyn Rains is Director of Health Services, Plymouth Public Schools. Michele Pecoraro, as Executive Director of Plymouth 400, what do you want us to remember today about your plans?
Well, I just would like everybody to remember that staying safe is number one, and a very tight, close second to that is our economy. And so we at Plymouth 400 are trying to, stay in the light, if you will, and do these virtual events so that as will other organizations. And then we want to do very safe events when we can, when the time is right for us to do that. And we will keep you informed as much as possible over the winter months.
Thank you, Michele Pecoraro. She represents Plymouth 400. Heather Cozby, what are your final thoughts?
I just wanted to basically say I expect there to be a lot more information in the next 2 weeks. So I know everybody's excited to get going. I appreciate Matt's additional comments clarifying. Of course, letting your bank know you want to be in the queue to get going. Absolutely. It's just everybody's been waiting to get their loan forgiveness done, move on with their life, but you really need to wait about 2 more weeks for more information to come. So just hold tight, continue to check SBA.gov, and check the dates that the information has been provided. Make sure it's something that's been provided after 12/27. Otherwise, Happy New Year to everybody. It is mind-blowing to me how long this show has been going on, how many people have been involved, how much information has been conveyed, and just to remind the viewers that it is all volunteer. I mean, everybody, Matt, Steve, Ken, who are on here every week. I thank you, Matt. I'm so happy you're in there again, and as well as everybody else that helps Plymouth. But it's mind-blowing to think of all the volunteering that's happened and come together. And Plymouth is just a wonderful town. The schools are wonderful. I thank everybody. So Happy New Year.
Thank you, Heather Cozby. She is a CPA in the town of Plymouth. Stephen Cole, what are your final thoughts?
Well, I just want to let folks know I woke up this morning to what I thought was a pretty impressive headline that also was a little redeeming for folks who took up video gaming during this downtime. Shanghai in China is looking to establish itself as the headquarters, the international global headquarters for what they're calling esports arena. That's going to come with a $900 million construction investment, as well as 1.5 million square feet. Esports is nothing more than just gaming, video games. So if you've gotten any grief over this period for video gaming, you can simply now say you are training for eSport Olympics. As a footnote, circling back to that number I threw out earlier, it got me thinking about Sony. Sony is one of those companies that absolutely has one of the world's largest platforms for gaming. And because I'm an internet nerd, I started diving a little deep. And incidentally, their very first product was in 1946, and it was an electric rice cooker, and it didn't sell well. So in fact, the founders started repairing transistor radios, and that ultimately led to the Sony name being adopted and their number one product, which was transistor radios. That wasn't the business plan. That was some guy's skill set. That was some guy's interest, hobby, and passion that now has grown into what we know of as Sony today. So I'm going to circle back to that number I threw out to you earlier. 2,209 members of our community are looking for a job. If you are looking for a job, or if you know someone who is, think about the type of job you want to have or you want your friends and family to have, and create it. Now may not seem like the right time to actually start a business, and I will acquiesce to that. I understand. But now is the time for you to start to think about the type of business you want to have, the type of
Thank you, Stephen Cole.
job you want to have. And who knows, skip ahead 40, 70 years, you could be the next Sony. Thanks, Steve.
Thanks, Steve. We're going to go to Matt Muratore, Plymouth State Representative. Your closing thoughts.
Yeah, just also want to indicate, I know Steve said that we passed the economic bill and transportation. We also passed a major climate bill as well. So more information will be coming out on that. So I think the message, Steve, is, first, I also want to congratulate the Plymouth, the Pawtuxet Plantation as well. They just announced a couple minutes ago that they received a $100,000 grant from the Mass Cultural Council. So congratulations to them. I think, the message I'm hearing today is we need patience. I know people are getting anxious to get the vaccine. We need to be patient about, getting the vaccine, about businesses getting grant money, about, testing, and just patience with each other. We're getting there. I know people see the light at the end of the tunnel, but we're not there yet. So let's continue to have patience, and let's continue controlling COVID, because it's not only good for the economy, it's good for the schools, and it's good for our health as well. So thanks again, Steve, and we'll see you next week.
Thank you. Thank you, Plymouth State Representative Matthew Muratore. And as we go back to Ken Tavares, he is the chair of the Plymouth Select Board. And Ken, Wicked Local reports that your vice chair is recovering from some health challenges, and we wish him well and a speedy recovery. Your closing thoughts.
Yes, thank you for the comments for Vice Chairman Quintal. He's doing well, and he spent last week in the hospital, but we're cheering him on. And as I said to the board last night, he hasn't lost his sense of humor, so he'll be back with us soon. A couple of closing thoughts, and that is that last night at the Selectmen's meeting, we interviewed 7 people who received 8 applications to be the alternate on the Board of Health. And I must say that any one of the 8 that put their applications in could have done the job. They were on different ages and experience, from young people just moving into the community to a retired MD from the local medical community. it made me stop and think of how fortunate we are in this community to have the wealth of people. The board actually went on for a few minutes talking about it because we were so excited at the caliber of the people that are in this community. So that gives us a great deal of hope. But the reality is, at the end of the day, and I agree with Matt, patience is needed in large doses. I dread looking at the numbers that come in. They are sobering, and we need to keep paying attention to them. We are seeing light in the tunnel, but we're not there yet. And we need to work together. And what I remind myself when I look at those figures and speak to some of you afterwards is to commit to what is important, not to what is convenient. Together, we will defeat this disease. We will do it. Thank you, Steve.
Thank you, Kenneth Tavares. He is chair of the Plymouth Select Board. And as we wind up today's presentation on January 6th, please join us next Wednesday, January 13th. We'll have a full panel. I'm Steve Triffletti, Plymouth Town Moderator. Thank you for joining us, and good day.